there's the deep system, which is in the middle of the leg. So if you think of your leg like a cylinder, it kind of runs down the middle of the leg. If you've ever heard of anybody that had a clot in their leg that went up to their heart or lungs, it's usually in that deep system. Then there's the veins we mainly treat or look at are right underneath the skin. They're called the superficial veins. So it could be kind of maybe a little aneurysm or something in one of those little veins. That's very rare. But we'll do a quick ultrasound and check it out for you. And then I'd be able to let you know better, you know, if we can treat it, get rid of it for you, if there's anything really that needs to be done, or if it should just kind of be left alone. Okay.
Bring your legs apart. Yep, and then turn your leg out more. Yep, just like that. So I'm actually going to go all along the inside there, okay? And by standing, you're going to create some pressure inside your vein, which I want to see. Yeah, so the reason why you see it right there, I don't know if you can see the screen. Okay, so this is protected by the fascia, and then as soon as we come here, it's outside of the fascia. And so that's why you see it.
Oh.
Okay, so this is the surface of your skin. So you just can't see it all up in there because it's protected. So the fascia, we have fascia all over our body. That's what helps so that things don't pop out. Honestly.
Mine has failed in that spot.
It has failed. Well, what's failed is that your vein is big. And so when your vein is big, then I'm going to press on you, okay? Just like that. When your vein is big like that, then the blood just pools there and it gets bigger and bigger over time. And then that dilatation causes the aching and can cause swelling. Okay, what I'm going to have you do for me when I ask you to, so I'm going to have you take a deep breath in, and then you're going to bear down or squeeze your stomach muscles. Okay, not quite yet, but when I ask you to, okay? Alright, so take a deep breath in, push down, and relax. Let your breath out. Yep. And then we're going to do that again. Take a deep breath in, push down, bear down, bear down, bear down, and relax. Let it out. Good job. We're going to do that one more time. Basically what I was just doing was a venous ultrasound, which is a diagnostic test to determine whether a person has reflux or not, which is basically when the blood doesn't move properly through the venous system. So you will notice that as I was augmenting or squeezing the distal part of her vein, the blood not only was, jetted through the valves back up towards her heart, but then also slid right back down, because those valves, which are like little cusps, they open and they're supposed to slam shut, but in this case they opened and they weren't able to meet all the way. So whether or not they were malformed or whether the vein was too big, they couldn't hold the blood back, and so that's why you heard the what we call reflux or insufficiency.